I'm Larry Menti. Welcome back to the Delaware Way. It's a lofty goal to prevent 1 million heart attacks and strokes across the country. It's going on in our state right now, and Denise Taylor is the project director of Million Hearts Delaware. So how do you plan on going about this?
So we are focusing on prevention on the ABCSs. Million Hearts Delaware is focused on the ABCSs of prevention.
What is that?
That's aspirin. A is for aspirin, B is for blood pressure control, C is for cholesterol management, and the S is smoking cessation.
So how do you get this? I know this is part of it, getting your message out by being right here, but how do you get this message out? What does it entail? It's easy to say that, but you have to go out and tell people this.
Right. So in Delaware, Christiana Care is spearheading our initiative. Dr. Ed Goldenberg is in charge of the initiative, and we are a statewide initiative with over 70 partners. So it includes all the major hospitals, American Heart Association, the Delaware Healthcare Association, and we are focusing on public awareness. We're focusing on engaging providers and doing screenings.
So when you say engaging providers, that is doctors? Is that what you're talking about?
Right.
So you're going at the doctor's office and saying, this is what you should be preaching?
Right, so we're helping them understand the ABCSs. We're reminding them, about how to get folks connected to the quit line, 1-800-QUIT-NOW, to stop smoking, for example. Encouraging them to use the best evidence-based practices for blood pressure control and home monitoring, for example, of blood pressure and cholesterol management.
Let's go through the ABCSs for a second. So aspirin, and that's just taking a baby aspirin every day?
Yeah, so it's much more complicated than that.
Oh, sorry.
And, and you need to work. So we have questions to ask your doctor. That's how we approach the public. We say the ABCSs, aspirin, is aspirin appropriate for me? That's a question you can ask your doctor, and they will work with you to figure out.
Well, because I've been doing that. I've been taking it. I don't know if it's appropriate for me. Is it just an allergy, or is it being allergic to it? I guess you would know that. Or is it that it's not right for everybody, even without that?
Correct. You need to work with your healthcare provider and figure out if it's better for you to take an aspirin or it puts you at higher risk for something else. Whether you're female, male, what age you are, your risk for cardiovascular disease.
Oh, that's interesting. I didn't know that. And B, what is B again?
B is blood pressure control.
And that's just getting your blood pressure tested and then taking steps if it isn't?
Right, so asking your doctor, are we doing everything we can to manage my blood pressure? Are there medications I should be taking? What is my blood pressure number? Knowing your number is an important thing. We let the public know that 120/80 is ideal or healthy, and you can get your blood pressure checked almost anywhere now, at any pharmacy, grocery store.
Who is funding all of this? Where are you getting your money?
Yeah, so Christiana Care is funding Million Hearts Delaware right now. And again, all the partners that come together across the state are working together to do screenings, to do public awareness. So you'll see things in the news journal, you'll see things through the different hospitals. They sponsor billboards. The American Heart Association is part of it. Lots of different sponsors. Lots of different partners.
Well, that's great. And so it's by 2017, right?
Right.
So that's when we have you back to see if you met your goal.
Yeah, there you
go. Denise, thank you so much.
Thanks.
I appreciate you being here. Denise Taylor, who is the project director of Million Hearts Delaware. It is a national movement. They're trying to prevent 1 million heart attacks and strokes by the year 2017. Coming up next, it's not just older people that have cardiac problems. It can start as early as high school. We'll meet somebody who's started a movement to get high school students tested for possible cardiac problems. That's when the Delaware Way continues.